I am continuing with the next video that we are talking about bleeding during pregnancy. When you bleed, when you are pregnant and confirm that you are pregnant, any form of blood coming out from your vagina, even if they are just drops of blood, spotting, once you discover that blood is coming from your vagina and you are pregnant, take that serious because it is a danger sign. I said that in the last video. I am repeating it here. But now, this video will target the causes of bleeding in late pregnancy. So I titled this Causes of Bleeding in Late Pregnancy. If your pregnancy is above 28 weeks, then you are in late pregnancy. Maybe your pregnancy is up to 30 weeks, 32 weeks, 34 weeks, 36 weeks, anytime after 28 weeks, then know that we are talking about you now. If you notice any blood during your pregnancy, that blood comes out through your vagina, and you know that your pregnancy is more than 28 weeks, what could possibly be the cause? What should you do? 1. We talk of abruptio placentae. Abruptio placentae or placenta abruption. Okay, that is one. What do we mean by that? Sometimes a placenta that is well located in the upper segment of the uterus begins to separate prematurely, meaning your pregnancy is not yet at term, your baby is still in the womb, you are not yet in labor, you have not yet given birth, but placenta start detaching from the wall of the womb. It starts separating. That we refer to it as premature separation. Why? Because a placenta in a normal situation should separate only after delivery, only after the baby is born. Then the pressure inside the uterine cavity drops, forcing the placenta to separate because the uterine muscle will contract. Now that placenta tissue doesn't have muscle, it will not be able to contract, but the womb muscle will contract, pulling itself away from the tissues of the placenta, and that is how the placenta separates. But if unfortunately you are still pregnant, your baby is still in the womb, you are not even yet in labor, and placenta starts separating itself from the wall of the womb. If that placenta originally was inserted in the upper segment of the uterus, which is the normal side of normal insertion of placenta during pregnancy, we will say that such a premature separation of a normally inserted placenta in the upper segment is known as abruptio placentae. This is common in our society. It could be caused by trauma, that some of you do violence in the house. You know, this gender-based violence, that you do violence even on pregnant women. Some men beat their wives during pregnancy. Yes, this is true. Just set your mind. If you are a wife beater, you know, some even slap, kick even the abdomen when she is pregnant. My dear, you are a killer, murderer. Don't do that. Because a common fall, like a woman could still fall, just slip and fall, or an accident meets a woman who is pregnant and hit the abdomen, and the placenta inside is affected and it starts separating. Wherever separation is occurring, there is tearing of blood vessels, and blood will leak out from blood vessels and will be bleeding. Either she's bleeding internally, or the bleeding begins to get way to flow outside so that you can see it. Therefore, with abruptio placentae, bleeding could be concealed, like internal, which is dangerous. as well as it could be revealed as you see the woman actually bleeding. Her abdomen may be very painful. She may come to hospital, even the doctor, just by sending a hand to touch the abdomen, she cries, ah! And the first thing we suspect is abruptio placenta. Because when it starts separating like that, some of the blood that oozes out is trapped there and it clots, forming a retroplacental blood clot. There are several types of abruptio placenta. I am not going to go to that detail now. I am bringing you the causes of bleeding once your pregnancy is in the later stage from 28 weeks and above. So you now understand that abruptio placenta is one of the causes. Number 2, placenta previa. Placenta previa, meaning that there is a disease resulting from premature separation of a low-lying placenta. Meaning that there are some women, when they get pregnant, the site of the placenta originally is down in the lower segment of the uterus. Meaning that their placenta from the word go was inserted in the lower segment of the uterus. That is not the normal site. But exceptionally, or unfortunately, some women get pregnant and their placenta, instead of being in the upper part of the uterus, it instead inserted in the lower part, meaning that there was already a risk factor. That is why placenta in the lower segment, we don't already call it placenta previa. No, it is predisposing to placenta previa. That is why you will never hear that placenta previa occurs in early pregnancy. Yet, in early pregnancy, the placenta was there in the lower segment, but it has not and will never be placenta previa. Placenta previa here, technically, by reproductive health experts, is understood to be a disease. But the position of the placenta is not a disease, it's the predisposing factor. When the womb will stretch, by the time they are reaching later part of pregnancy, the womb has grown big, stretching, okay, causes the lower segment of the uterus stretches and then causes premature separation of that placenta that is in the lower segment. When this placenta in the lower segment starts separating while the baby is still in the womb, the woman will notice blood, she will notice that she's bleeding. But this kind of bleeding has no pain. My dear mother, anytime your pregnancy is more than 28 weeks, whether it's 31 many weeks, and you notice blood coming out from your vagina, and you seem not to be feeling any pain, they even come to hospital, they are touching your abdomen, they try to listen to the baby pipette, you are not feeling pain, but you are bleeding. Typical situation of the placenta previa, telling you that your placenta first was in the lower segment and now is separating before time. I take time to explain this so it could make sense even to health experts who have been finding it difficult differentiating a typical disease of placenta previa from just the presence of the placenta in the lower segment. Yes, some women have placenta in the lower segment, which may just be on one side, and they may still carry their pregnancy till term and deliver through the vagina without witnessing bleeding. In that case, that particular woman has not suffered from placenta previa, but her placenta originally was in the lower segment, predisposing her to bleeding in late pregnancy. And it is this bleeding in late pregnancy that is a disease. We call it placenta previa. Rush to the hospital, leave it in the hands of the health experts, and they will help you manage it to see that you stay healthy and your baby in the womb remains healthy. Number 3 cause of bleeding in late pregnancy is uterine rupture. Sometimes trauma to the womb could tear the womb of the woman. Now, some women actually get into wrong practices, taking certain drugs or traditional concoctions. Some will tell you that my grandmother that said that when you are going nearer to delivery, you can begin to lick this, or you can begin to lick this. You make labor to start, and then when it starts, you deliver like a Hebrew woman. No, we do not encourage a woman to take anything that has not been well studied. Take any drug, whether traditional or not, which is not prescribed. And sometimes the traditional herbs, they work very well. But my dear, not for the pregnant woman. If it must go to the pregnant woman, then it has to be studied well, so that some of the elements found in this herb that could be teratogenic. Teratogenic means could be killing to the baby in the womb. It could be having very negative effect to the growing fetus in the womb. That's teratogenicity. You don't know about this. So avoid taking them, because you may take some of these and they go and contract your womb and end up tearing your womb inside. That is uterine rupture. Some of you even get into labor and you go into wrong hands and they begin to climb on your abdomen and press with their hand. Where do they still do that on this earth? We call it fundal pressure. Yes, our forefathers, even some of us, when I studied midwifery, then we were still doing fundal pressure, and we thought it was helping the woman during labor. No. World Health Organization, what we call WHO, completely proved that this is bad practice. No midwife does this, no doctor does this today. They can augment uterine contraction if truly there are weak contractions, inadequate uterine contraction. They can augment that labor. There are ways they use it in the maternity. They train the doctors, they train the midwives, they train the nurses, they train those, and they know how to do it. And today, people are well learned, and they are not climbing on the abdomen of a woman again during labor and pressing to say that they are forcing the baby to come out. A lot of such practice causes uterine rupture, and the woman could be bleeding internally and even externally. And this can easily lead to maternal mortality. Let us avoid it and avoid accidents and avoid the drugs that could predispose the uterus of a woman to tearing, to rupture. Are we understanding? Yes. Number 4, vasa previa. There may be just a prolapse of a blood vessel and can rupture and bleed. That can happen anytime. Number 5, local causes. Like I said, there could be a tear or a wound on the vagina, maybe sustained through rough, traumatic sex. Some people are involved in such, which is not good, not healthy for a pregnant woman. Some have long nails and then they keep putting fingers in the hands. Some of you like fingering. No, please, you can wound the vagina of a pregnant woman and then she notices blood and she's alarmed and she may rush to hospital. Well, experts will check and determine that, the bleeding is coming from the wall of the vagina. It is coming from the cervix. It is coming somewhere but not affecting the pregnancy itself deep inside. In that case, your case is diagnosed and managed. In any of such cases, anytime you notice bleeding, when you know you are pregnant, please, even if that bleeding is just drops, rush to the nearest health facility. Go to the hospital. See your doctor. Let them try to diagnose and manage. To diagnose means let them determine the cause. The earlier, the better. And then treat the situation so that they can keep you healthy and your unborn baby healthy. My name, Dr. David Ayim. As I said, I hold a PhD in public health. I am a reproductive health expert. I am a midwife. Subscribe to this channel and we will be discussing reproductive health every now and then. Ask your questions. Make your comments at the comment section. Or write to me, preferably on WhatsApp, 674-6054-69. If you are out of Cameroon, where I am, you you can simply add plus 237 before you put the number. And then you will get to me. And then you will be well. Share and share. Thank you.